Let's take our next call today. We will go to the 701 area code. We're taking calls at 617-830-4750. 701 caller, what's your name, where are you calling from, and jump right into your question.
Hey, David. This is Paul here from Fargo, North Dakota.
Great.
Question is, I'm kind of curious what your thoughts are, maybe what some of the audience might think too, about a different kind of approach to kind of taking on healthcare. We know that Bernie Sanders, is supporting the Medicare for all, and we know that there's that bill that's kind of going to be getting pushed through right now. Pending that a lot of the, maybe more corporate Democrats and Republicans, I just don't really see that going far. Curious what you thought of a new approach, maybe, consumers directly kind of organizing their own sort of protests, maybe kind of outspoken movements, maybe against the insurance companies directly, because bad press sometimes gets the conversation changing, can create product recalls, etc. So I'm kind of curious what people might think about that.
Well, listen, Wendell Potter wrote in his book Deadly Spin, and we've interviewed him about this, about how a specific insurance decision not to cover, I think it was a young girl's, I don't remember if it was a liver transplant, or I don't remember the specifics, but the bad press around it made the insurance company reverse their decision in that particular case. I don't know what you're thinking of that would make insurance, in other words, I don't know what kind of protest could achieve fundamental change, because if you're protesting the insurance companies, the real solution, which is a single payer type system, would cut out insurance companies altogether. So you're not going to get insurance companies to say, hey, we're going to shut down because people are protesting us. So I like the idea of a so-called consumer revolt against insurance companies that are making money off of deciding who gets what treatments, but I'm just not sure what you have in mind that could actually get change to happen.
Right. Yeah, no, and I fully support single payer. That's my goal as well. Pending that legislation can't get done in a, expedient amount of time, I was kind of thinking more so maybe protesting premium cost deductibles, that sort of thing, more so.
Yeah, I mean, the thing is this, it's just simple math, right? So premiums, insurance
Hmm.
companies in many cases have sort of a certain amount of premiums that they have to pay back out for reimbursements for treatment, right? For procedures, treatment, medications, et
Right.
cetera. So we sort
Right.
of know, like, if you don't have young people, if you don't have a mandate for young people, the average health level of the people who are insured is going to be lower, and thus premiums are going to go up. A lot of it has to do with math. So I think it's a non-starter to say, let's protest so that premiums will go down. A lot of these things are sort of dictated by the broader system and math. But I like the way you're thinking about it. I think we need to think about it more and think what the best path forward would be.
Right. Yeah, I agree. Yeah, and I'm not all too familiar with the mathematics behind it, so I mean, yeah, I may not even be on the ball on that necessarily either.
Hey, but
So
listen, you're
yeah,
thinking and you're engaged, so that's important. Thank you so much for the call. Really appreciate it.
yeah.
Definitely an issue that we're going to take up again.